So what is an ingrown toenail? I'm going to demonstrate that in this video of this 26-year-old female who had a chronic recurrent ingrown toenail to the lateral border, which is the outside border of the great toenail on this left foot. Ingrown toenails are more common on the great toe, most likely because they're bigger, the nail's larger, the toe is bigger, it gets pushed and squeezed into shoes more frequently than the other toes, and they tend to occur more commonly in the great toe. Not that they don't happen in the other toes, because they do, but it's more common in the big toe, or what we refer to as the great toe. And here you can see we're numbing or anesthetizing the toe with some Marcaine and lidocaine. We perform a digital block, which is also a ring block. We get anesthesia around all four nerves of the great toe. And you can see now we're putting on a tourniquet. This is going to stop blood flow to allow us to perform this procedure. It's a temporary reduction of blood flow. And then we will go in and free up that incurvated portion of the toenail. So why does this happen? Well, a number of reasons. It could be that you cut the toenail incorrectly and maybe pulled on it and it created a small spike under the nail fold, which is the collection of skin next to the toenail. And then once that breaks into the skin, your normal bacteria on the skin can get into that area, create an infection, and then it creates a circular process. The skin becomes swollen, the nail pushes in, and it continues to become painful and swollen, infected, inflamed, and we have to remove that portion of toenail to get the problem to resolve, and that's what we're doing here. Now, this patient elected to have a permanent procedure done, which means the nail plate will not come back because we're going to introduce phenol, which is a chemical, and that creates a chemical burn to stop those cells from growing the toenail. And that's done as opposed to a nail avulsion, which is temporary. So this patient had several cases of an ingrown toenail, and rather than keep removing it temporarily and letting it grow back, and it takes about 6 to 9 months for a toenail to grow back. So if your toenail's been removed, if it's been damaged, any problem to the toenail, it takes a good 6 to 9 months for that nail to grow out and grow back. So if you remove it temporarily, and then about a year later, or sometimes even 6 months later, you get another recurrent ingrown toenail, it's probably time to have it fixed permanently. So if you've had this done and they didn't use the chemical and it comes back, there's a good chance you'll need to have what is known as a matrixectomy, and that's what we're doing here. You can see I'm putting the chemical in there now. We put roughly 3 applications for 30 seconds. I say roughly, so it's a 3 application procedure. Time varies, but the goal is to ablate those cells that grow the toenail, and that's what we are doing here. Once that's done, it's about a 2-week recovery. It takes a good 2 weeks for the inflammatory process to calm down and let the wound heal, and you won't see a deep groove. What you'll see is the skin will kind of fill into that area, and it'll granulate in and form more epithelial tissue over it, which is just your normal outer layer of skin. Eventually the epidermis forms, and it's really not noticeable. A lot of patients will ask me, does it look deformed? Or people going to know that I had part of my toenail ripped out, as they refer to it? Not really. I usually say the only people who will know is me, you, and if anybody else has had this done sometimes. Sometimes I can't even tell when patients come back that the corner was removed because the skin tends to fill in and you really don't even notice it. So removing that tourniquet here, bandaging up the toe, this stays on for 24 hours. Then that bandage comes off, and then the patient will start soaking it in warm water and Epsom salts, or they can use warm water and antibacterial soap. Then the next step is to apply Neosporin or any antibacterial ointment and a Band-Aid. They'll do that twice a day for about 2 weeks. Sometimes it can go on a little longer, 4 weeks even, depending on how involved that burn was, and this will prevent the toenail from reoccurring. So if you have any questions about ingrown toenails, or you want to find out why this happens, or any other problems with the toes or your foot and ankle, drop them in the comments section below and I'll do my best to answer them.